Hi everyone, today we will be talking about labor and the neonatal adaptations. In the first part of our lecture, we will be covering the labor, physiology of labor. First, let's define what's meant by labor. Labor is the physiological process by which a well-developed fetus is expelled from the uterus to the outside world. When does labor occur? Labor occurs usually 270 days after fertilization or 284 days from the first day of the menstrual period preceding pregnancy. Signs of labor. We have first we have labor pains, either false then true labor pains. We have the rupture of membranes, some bleeding, which is called show, and the cervical dilatation and effacement. What is the mechanism of labor? For labor to occur, we have two main mechanisms. The first one is the hormonal mechanism, and the second one is the mechanical factors. Regarding the hormonal mechanism, it includes estrogen-progesterone ratio, oxytocin, relaxin, and prostaglandins. First, let's talk about the hormonal mechanism of delivery or labor. The first hormonal factor is the estrogen-progesterone ratio. As you know from before, that progesterone usually decreases the uterine contraction during pregnancy. So it usually prevents abortion, prevents preterm labor. While estrogen, usually it increases the uterine contraction during pregnancy. So the ratio between these two hormones is very important for their effect on the myometrial contraction. We find that by the 7th month of pregnancy, progesterone started to decrease markedly, while estrogen started to increase markedly. And this change in the levels of progesterone and estrogen will lead to increase in the uterine contractions and initiation of labor. The second hormone which is involved in the labor mechanism is oxytocin. So oxytocin play an important and essential role in the initiation and the maintenance of process of labor till the fetus is delivered. During early labor, oxytocin level is normal. However, the increases in estrogen will increase the receptors of oxytocin. So even if we have the normal level of oxytocin, but the action of oxytocin will increase due to increased number of its receptors. Once the labor starts, we start something called positive feedback mechanism, in which the uterine contraction will push the baby against the cervix, stimulating the cervix stretch receptors. This will send impulses to the posterior pituitary gland to increase the oxytocin release. And the oxytocin, by turn, it will also increase the uterine contraction. So we will enter in this vicious cycle of impulses going to the posterior pituitary to stimulate oxytocin release. Oxytocin increase the uterine contraction push the baby more towards the cervix, more nerve impulses to the posterior pituitary, and so on. The third hormone that play a role in the labor is relaxin hormone. So relaxin hormone, from its name, it acts to relax pelvic joints. It also soften and dilate the cervix. So it will help the passage of fetus during labor from the cervix. But relaxin also inhibits uterine contraction. So its secretion started to decrease in the last days of pregnancy to allow uterine contraction to start and labor to occur. The fourth hormone is prostaglandins. Prostaglandins are secreted by the end of pregnancy. They are secreted both from the uterus and from the fetal membrane. Prostaglandin secretion is stimulated by estrogen and oxytocin, and they act to increase uterine contraction. Now we will talk about the mechanical factors involved in the labor. So when the cervix is stretched by the head of the baby, this usually leads to reflex contraction of the uterus. And this contraction of the uterus will lead to more impaction of the head onto the cervix, and so on. So more stretch will lead to reflex contraction, and so on. As we mentioned before, also the stretch of the cervix will stimulate the pituitary gland to secrete oxytocin, which will also increase the uterine contractility. Now we will discuss the role of corticotropin hormone in the initiation of labor. The first step that initiates labor could be explained by the significant increase in the fetal corticotropin hormone. This hormone is released from the fetus adrenal gland, and it results in increase the cortisol secretion, and this will help in the maturation of the lung and make the baby ready for initiation of normal respiration. Also, this will increase the estrogen secretion, and the estrogen secretion will increase the contraction by increasing the receptors of oxytocin, as we mentioned before, increase the number of gap junctions between the myometrial cells so the contraction become more forceful, and also it will increase prostaglandins, which also increase the uterine contraction. Now we will talk about the neonatal adaptations, or the fetal to neonatal transition. In this part of the lecture, we will discuss the mechanisms by which the neonate adapts for the new life it will start outside the uterus. So what is the physiology of this transition? We have many systems that undergo this transition. We have the initiation of respiration, respiratory system adaptations, cardiovascular adaptation, hemobiotic adaptation, hepatic adaptation, renal adaptation, thermal and metabolic adaptation. First, we will discuss the initiation of respiration. So the process of initiation of respiration is usually stimulated by several factors, either chemical factor, thermal factor, sensory factor, and mechanical factor. So first, let's talk about the initiation of respiration. The first factor that is involved in the initiation of respiration is the chemical factor. So what happens is, at the moment of birth, the fetus or the fetus is usually suffering from temporary asphyxia. This asphyxia occurs with cutting of the umbilical cord, and the cutting of umbilical cord will lead to stoppage of passage of oxygenated blood from the umbilical vein to the fetal circulation, and also cessation of placental gas exchange. Due to this asphyxia, the respiratory center in the medulla will be stimulated, encouraging the fetus to start its own respiration. The second factor which involved in the initiation of respiration is the thermal factor. So after delivery, the fetus is exposed to the external temperature, which is usually less than the temperature inside the uterus. This decreased temperature will stimulate cold receptors in the skin of the fetus, leading to excitation of the respiratory center. The third point is the sensory stimulation or the sensory mechanism. In this sensory mechanism, the senses of the fetus start to receive impulses from the surrounding environment. For example, when holding this newly born infant, this will lead to stimulation of the touch receptors in the skin. Also, hearing sounds in the external environment, this will send impulses through the auditory receptors. And the exposure of the light outside the uterus will also send visual impulses. All of these impulses will go to the brain to stimulate the respiratory center to start the respiration. Then we have the mechanical factor. So during delivery, especially when we are talking about the normal delivery, the vaginal route, the baby is squeezed during while it is passing through the narrow vagina. This leads to compression of the chest during labor, and this compression will push about third of the fluid which is still present inside the lung outside the fetus respiratory system. The minimum amount that will continue to be in the respiratory system will be reabsorbed later by lymphatics. The chest will be compressed, and after delivery, the re-expansion of the chest will lead to will create a negative pressure. This negative pressure will help the inspiration and taking the first breath of the fetus. Another thing that when the air starts to enter to the lung, this will increase the pressure of oxygen inside the alveoli, and increasing the pressure of oxygen inside the alveoli will lead to vasodilatation of the pulmonary arteries. So the pulmonary vascular resistance will decrease, and the blood flow will increase. And in this case, we will start to have the pulmonary circulation active, and the process of respiration is initiated. The third hormone that play a role in the labor is relaxin hormone. So relaxin hormone, from its name, it acts to relax pelvic joints. It also soften and dilate the cervix. So it will help the passage of fetus during labor from the cervix. But relaxin also inhibits uterine contraction. So its secretion started to decrease in the last days of pregnancy to allow uterine contraction to start and labor to occur. we will be talking about the cardiovascular adaptation. Let's first discuss the fetal circulation. So the fetal circulation starts by moving of the oxygenated blood through the placenta to the umbilical vein. And from the umbilical vein, it passes through ductus venosus to the inferior vena cava, reaching the right side of the heart. Then the blood passes from the right side of the heart to the left side through a foramen which present between the two atria called foramina ovale. In this way, the blood of the fetus is bypassing the lung because the lung is not fully functioning or it's not functioning. Then from the left side of the heart, the blood passes to the left atrium, to the left ventricle, then to the aorta, and then to the different body parts. Now we will discuss the role of corticotropin hormone in the initiation of labor. The first step that initiates labor could be explained by the significant increase in the fetal corticotropin hormone. This hormone is released from the fetus adrenal gland, and it results in increase the cortisol secretion, and this will help in the maturation of the lung and make the baby ready for initiation of normal respiration. Also, this will increase the estrogen secretion, and the estrogen secretion will increase the contraction by increasing the receptors of oxytocin, as we mentioned before, increase the number of gap junctions between the myometrial cells so the contraction become more forceful, and also it will increase prostaglandins, which also increase the uterine contraction. After delivery, the umbilical cord is clamped. This will decrease the blood flow, and by turn the pressure on the right side of the heart will decrease. At the same point, we have initiated the respiration, and with initiation of respiration, this will lead to lung expansion and increase in the oxygen tension inside the alveoli, which will decrease the pulmonary resistance and increase pulmonary blood flow. So more blood will be going to the left side of the heart. So in the fetal circulation, we use it to have the pressure on the right side of the heart more than the pressure on the left side of the heart. And this which kept the foramina ovale open. While after delivery, due to this transition in pressure, so the pressure on the left side of the heart will increase and even become higher than the right side of the heart, leading to closure of the foramina ovale between the right and left atria. Also, the ductus arteriosus will be closed, which between the ductus arteriosus, which is between the pulmonary artery and aorta, and clamping of the cord will lead to closure of the ductus venosus. So all these structure will be closed and fibrosed and turn it into ligaments. This is the circulation of the fetus after delivery. So first, because the umbilical vein is clamped, now the ductus venosus is closed and it is transformed to ligamentum teres hepatis. Also, because the pressure on the left side become more than the pressure on the right side of the heart, the foramina ovale also will close, and the ductus arteriosus between the lung and between the aorta and the pulmonary artery here, ligamentum, will be closed and transformed to ligamentum arteriosum. Besides these changes in the cardiovascular system, we also have the heart rate Initially, the heart rate after delivery is about 175 to 180. Then it started to gradually decrease to 120 to 150 beats per minute. The blood pressure of the fetus is usually 74 over 47 millimeter mercury. Then it started to increase by 20 to become 90 over 70. What is the mechanism of labor? For labor to occur, we have two main mechanisms. The first one is the hormonal mechanism, and the second one is the mechanical factors. Regarding the hormonal mechanism, it includes estrogen-progesterone ratio, oxytocin, relaxin, and prostaglandins. Now we will talk about the hepatic adaptation. So usually the infant have enough stores of iron which can cover its need during the first 6 months after birth. After this period, the infant will need to get iron from external sources such as diet. Also, we notice that after birth there is increase in the destruction of RBCs. And usually to deal with this state we need mature liver to deal with it and transform the bilirubin which is released from these destructed RBCs to conjugate bilirubin. But because the liver here is still immature, it will not be able to conjugate bilirubin, and the level of bilirubin will increase in the blood, leading to this yellowish discoloration in the skin of the newborn, which we call physiological jaundice. So the physiological jaundice means the increase in the level of unconjugated bilirubin up to 4 to 6 milligram per deciliter. Now the renal adaptations. So first of all, the kidney of the newborn is still not fully functioning, and one of the functions of the kidney that is still not mature enough, which is the ability of the kidney to concentrate urine. This will lead to passage of diluted urine from the neonates due to this inability of the kidney to concentrate urine. Also, we find that the fetus usually, the neonate usually have some kind of metabolic acidosis. And this metabolic acidosis means increase in the level of the acidic compounds in the blood due to accumulation of metabolites. Usually these acids the body get rid of them through the kidney. But because the kidney is still not fully functioning, so these acids like the pyruvic and lactic acid will start to accumulate inside the body, leading to this state of transient metabolic acidosis. The second point which will lead also to metabolic acidosis is that usually the kidney is not able to keep all the bases, so the neonate started to lose some bases in the urine, which also will increase this metabolic acidosis. This is the circulation of the fetus after delivery. So first, because the umbilical vein is clamped, now the ductus venosus is closed and it is transformed to ligamentum teres hepatis. Also, because the pressure on the left side become more than the pressure on the right side of the heart, the foramina ovale also will close, and the ductus arteriosus between the lung and between the aorta and the pulmonary artery here, ligamentum will be closed and transformed to ligamentum arteriosum. So the newborn will try to keep its body temperature and to stay warm by the following mechanisms. First, increasing the muscle activity, which will produce heat and keep the body warm. Burning of the brown fat, which is called or known as non-shivering thermogenesis. Peripheral vasoconstriction of blood vessels going to the skin and superficial part, which will lead to decrease of the heat loss from these parts. These mechanisms will keep the newborn warm and prevent the loss of body temperature. Another point related to the metabolic adaptation is that during the fetal life, usually the fetus gets its need from glucose from the maternal blood. And this maternal glucose go to the fetus and give it the enough energy to either grow and also to store some of these glucose in the form of glycogen in the liver. The fetus will use this glycogen after birth in producing more glucose and to keep the body sources of body sources of energy. So during labor, there is increased release of catecholamines, which will lead to mobilization of this glycogen from the fetal liver. But this blood glucose level usually decline after 1 hour of age. Okay, thank you and see you later.